Hi, my name is Katie, and I've been an Oakland County resident for 35 years. I'm in my 11th year of nursing and have worked for Henry Ford since 2014. I'm an educator on a general practice unit where we do care for COVID patients, most of which are fully vaccinated. The threat from my employer all started in March of 2020 when I, like many others, received an email stating that I was deployed inpatient to help during the pandemic and to care for COVID patients. If I did not accept, I would be suspended for 3 days, offered the same assignment, and if I refused, I would be fired. I was deployed for 3 months and received no COVID pay while caring for COVID patients. We did run out of PPE, received 1 surgical mask per week, and even had to wear trash bags as gowns at one point. In June of 2021, I received an email from Henry Ford threatening termination of employment, this time for noncompliance with their COVID vaccine mandate by September 10th. The hospital offered COVID listening sessions for staff to ask questions. I attended and I did ask questions respectfully. Shortly after, I was greeted by the chief nursing officer and administration stating they noticed I was at the sessions and that I seemed distressed. They said I needed to take a week off of work to think. I was told that as a leader, it is not my job to question policy. This was followed up with an email from the CNO stating I would be off work for the week and I needed to report to her upon my return. When I did return, I was pulled aside for a meeting with the CNO, HR, and leadership in the middle of my 12-hour shift with a 6-patient assignment and a nursing student. I was warned that I could have been fired for my questions at the listening session. I was warned that as a leader, I must get on board with what the system is doing. I was told not to answer any further questions regarding the COVID vaccine. I was offered help finding another job and told that if I disagree with this mandate, I should be respectful to leadership and administration and resign my position. Since then, I've been pulled aside almost every shift by management and asked, do you have questions about the mandate or your termination? How do you feel about me posting your position? It's constant harassment. All managers have been sent a list of employees on their unit who have not been vaccinated. These staff are now being pulled aside one by one and questioned. They are being pressured, coerced, and intimidated into receiving the vaccine. They are being told they won't be able to find other jobs in healthcare, and those in school are being told they must comply in order to receive future education. We have now been branded anti-vaxxers and have a scarlet letter on our chest. I ask you, what happened to HIPAA? Is medical segregation okay? Now Henry Ford is offering a $10,000 sign-on bonus for nurses and $25 extra an hour for extra shifts. They are actively recruiting Canadian nurses and agency nurses to fill our positions. We went from hero to zero, essential to expendable. Please, I ask you to consider who will care for you when Henry Ford forces us to voluntarily resign our position for refusal of vaccine mandate. After working through this entire pandemic, risking our lives and staying healthy, they will even make receiving unemployment a challenge. Please help us support our freedom of choice. It is the best thanks you can give to all healthcare workers and to your community. Our body, our choice, and as we said when we came here, for liberty and justice for all.
Thank you. Hey. Kristen Noble, followed by Beth Felix.
My name is Kristen. I am a resident of Oakland County. I have been a registered nurse for 10 years. All 10 years of my career, I have been employed with Henry Ford Health System. I was not going to speak tonight, number 1, because I'm terrified of public speaking. Number 2, because this is the most hectic time of the day for my family. But being here and letting my voice be heard is more important. The week I returned from maternity leave in June, I found out about the system mandating the COVID vaccines to employees, volunteers, contractors, and students. I'm appalled of such a decision to mandate these non-FDA approved vaccines, or we face termination. Katie and I are co-workers and are pretty much the only ones on our floor who are publicly protesting and speaking out. We are being the voice for others who are too afraid of having a target on their back, to be harassed, discriminated against, or coerced. Afraid if they do not comply, they will lose health insurance for their families, afraid they will not be able to pay their bills or put food on the tables. I myself was one of these individuals afraid to speak up. My husband and I had many conversations about whether I should take the vaccine or not, mainly for financial reasons. Ultimately, we decided I would leave my job standing up for my freedom of choice. There are so many coworkers, volunteers, students, and vendors within the system who feel the same way but are too afraid to speak up. This is against the law, so why are we even having this conversation? It's my body, so it should be my choice. I shouldn't have to choose my job or a vaccine. I am here asking you to help us instead of helping divide us. These are people's livelihoods and lives we are talking about. As nurses, we are taught that we are a patient's advocate and to always speak up for them. But here I am in this moment. I cannot advocate for myself, for my body, or for my choice with my employer. If these health systems are so worried about the safety of their patients by mandating all of us to be vaccinated, then why can a sick, immunocompromised patient on a general practice unit have no limit on visitors or restricted visiting hours? And visitors do not have to prove vaccination status. Why? Because that would be a violation of HIPAA for them to disclose their information. So I ask, who are we really protecting? If you disagree with me, that is the great part about living in America, the land of the free. You are given choices. Hopefully you will be so lucky that you do not have to choose between your job or being vaccinated. I ask that you will do your own research outside of the mainstream media. My life is more important. Being able to watch my kids grow up and be there for them is more important than a job. I am willing to give up all of that. I am not willing to give up all of that for the possibility of developing a debilitating side effect or the possibility of death. Thank you for your time.
Thank you.